Stop scrolling for a second. If you've ever thought that one testosterone shot is all it takes for an instant transformation, you might want to hear this, especially if you care about your sleep, your mood, or your future fertility. Testosterone replacement therapy, or TRT, isn't a shortcut to better workouts or a quick fix for low energy. Before you even consider it, focus on the basics. Get 7 to 9 hours of quality sleep, lift weights 3 to 4 times a week, add in some steady cardio, eat a protein-rich diet, and keep stress and alcohol in check. If you're still feeling off after dialing in these habits, that's when it's time to get tested. Testing isn't about guessing. You'll need 2 separate morning blood tests for total testosterone. If something seems off with your SHBG or sex hormone-binding globulin, you'll want to check your free testosterone with a reliable method. It's also important to look at LH and FSH to figure out if the issue is with your testes or the signals from your brain. Other labs like estradiol, thyroid, prolactin, lipids, and glucose can help fill in the picture. TRT is only for those with both symptoms and abnormal labs. Just feeling tired or seeing a dip in your numbers isn't enough. The goal is to restore healthy, natural testosterone levels, not to chase bodybuilder numbers. SHBG levels can change with things like thyroid issues or insulin resistance, so context matters. Avoid shortcuts like oral anabolics to lower SHBG. They come with serious risks. Supplements might help a little, but your habits and a proper diagnosis are what really matter. DHT, a form of testosterone, can affect drive and mood. Medications that block DHT can help with hair loss but might impact your libido or mood. These are decisions to make with a clinician, not based on internet advice. If you're planning to have kids, know that TRT can lower your sperm count. Ask about fertility-preserving options before starting any therapy. If you do start TRT, choose the method that fits your life, whether that's injections or gels. Start with a low dose and adjust slowly. Regular monitoring is key. Keep an eye on blood counts, lipids, liver enzymes, and prostate health. Watch for thick blood, and only use aromatase inhibitors if truly needed. TRT can boost energy, mood, libido, and training quality, but fat loss and blood sugar still depend on your lifestyle. Remember, TRT is a tool, not a replacement for healthy habits. Test right, treat responsibly, and protect your fertility. Monitor closely and keep your lifestyle strong. If you want clarity instead of guesswork, book a science-first consult at trtnyc.com. No hype, no shortcuts, just your health and your goals done right. This video is for educational purposes only. Always consult a licensed clinician.